Hi there, and thank you for joining us for our virtual CU Anschutz Wellness Series, Happy and Healthy Hour. We're thrilled that you're taking the time today to connect with the CU Anschutz alumni community and focus on your wellness. My name is Craig Wimmer, and I'm the Director of Student Health Promotion for the Office of Student Affairs. I'm a fairly new member of the CU Anschutz community, having started last April. My family and I, we moved from Oregon, where I'd worked for just over 15 years at a mid-sized undergraduate university and developed a health promotion department. So being fairly new to Colorado, wish us luck as we face our first significant snowstorm here this weekend. Our health promotion department provides events and resources similar to tonight's presentation for the student body. Beyond workshops, we also have digital wellness tools, weekly newsletters, and have student health promotion committee that leads initiatives to promote wellness from a student perspective. This year, we've also developed a new peer coaching program to create peer support and encouragement during this challenging time. I'm excited and honored to be joining a community where wellness is a core value, and I look forward to engaging and supporting students' holistic well-being as they pursue their academic and their career goals. For those of you attending your first Happy and Healthy Hour, this series was developed to provide practical tips to support your self-care as health professionals. The series has covered topics from sleep health to the positive effects of animal connections to burnout in healthcare professionals. And today we're bringing you campus expertise on a topic that might affect us all: balancing your mental health in a pandemic, mitigating health professional burnout as a stress and injury. And now I have the privilege and honor to introduce tonight's speaker, Mandy Doria. Mandy joined the CU Anschutz Department of Psychiatry in August of 2019 as a triage counselor and wellness coordinator for the student and resident mental health clinic. She has led a variety of campus efforts on mental well-being, groups, outreach, destigmatization efforts, crisis intervention, and teaching mental health first aid. Throughout her career, she has worked in a variety of home, school, college, and community mental health settings with children, family, and adults. Before moving west to Denver, she had a full-time private practice in Scranton, Pennsylvania for 6 years, taught yoga and ballet, and was a main presenter for the LRJ Foundation, which provides suicide prevention training and conversations to destigmatize mental health in schools and communities. She is the middle of 5 girls, mom of 2 rescued sibling cats, Pip and Stevie, and enjoys hiking, dancing, yoga, and roller skating. So with that, help me in welcoming Mandy Doria.
All right, thank you so much for that warm welcome, Craig. It's really good to be here. And normally this isn't the format I'm used to. I like to see faces and I just know you're all out there. So what I'd encourage you to do is, it is a healthy and happy hour, and it is 5 p.m. Mountain Time. So I have a cup of tea. Maybe you can grab a beverage or get into something comfortable if you're transitioning or if you're on a drive home. You're listening in, just hello to everyone. And we'll be curious about who's logging in. So let's do our first poll question. I'm going to pull up our objective slide just as I am thinking about our conversation today. And we want to know where you're coming from, what your affiliation to CU Anschutz is, whether you're in the School of Medicine, nursing, pharmacy, dental, public health, graduate school, or if you're currently engaged with us as staff or faculty. So we'll give a moment for you to answer. And as you're doing that, I'll read our objectives for today. So we're going to learn some signs and symptoms of mental health distress and burnout. And we're going to do that through the lens of the Stress Continuum as a self-awareness tool, which can help us mitigate the impact of stress and burnout. We'll also learn positive self-care strategies and the importance of charging your battery. And we'll learn when and how to seek help or how to suggest help to others. So with that being said, let's see where we're coming from today. All right, looks like about a third of us are from the School of Pharmacy, some dental folks, nursing, good to see you here, and School of Medicine, and about a third of current faculty and staff, and 14% of other. Really nice. Thanks for joining us. So my first slide is very simple. What is mental health? Mental health is basically how we think, how we act, and how we feel. It's the ability to live, laugh, love, and learn, do the things that we enjoy, have satisfying relationships. When COVID hit, our life as we knew it was pretty much over, right? When we think about, for example, before 9/11, it's almost like a different world. Everything has changed since, and COVID is almost like the same in that respect. Our routines have been upended, our sense of satisfaction and enjoyment have been thwarted, social connections taken away from us, becoming unsafe to be around each other, which is the root of human satisfaction in those connections, just not being able to do so. And then just not having the predictability of how to cope with our stress, not to mention the ever-changing circumstance of our world, political and social unrest. I mean, what a year. The good news is you've made it this far, so congratulations. And I just wanted to open up a conversation about mental health because we all have mental health. It's a part of our whole makeup as a person. It's a part of our physical health and medical health. So we may have encountered some problems with our mental health this past year. And I just want to indicate here that you don't have to have a mental illness to have a mental health problem, right? One is diagnosable and perhaps the other is not, but they can both be treated. So I just wanted to gently remind us of some signs and symptoms to look out for. Recent data suggests that 87% of Americans have reported struggling with their mental health this past year, or that their mental health is suffering. So some of these things may, have definitely come up for you. I know for me, there were definitely periods of time working from home, just sort of that never-ending tunnel. Maybe if you're more on the front lines working, with patients, a lot of unrest and issues that have come up and just ever-changing circumstances of what's expected of you. The last thing I want to point out on this slide, because I'm not going to go through them all individually, is just to notice that it's a change for the individual. And it's usually a cluster of these, creating this perfect storm, so to speak, impacting our life in a negative way. So these are some things that you can notice here. On the other hand, burnout is a huge epidemic as well, not only for physicians, but for any of us this year, whether or not we work with COVID or have interfaced in the healthcare system. And these are just some of the symptom checklists that actually comes from our behavioral health and wellness program in their physician wellbeing toolkit. And we'll paste the link in the chat if you want to learn more. It's a wonderful self-guided toolkit. And you can go through and explore what your signs and triggers are for burnout, as well as develop action steps and a plan. They also have a self-assessment for the 8 dimensions of wellness, where you score yourself from 1 to 10 and kind of see where you can find more balance. So some of the common signs that I'm seeing in burnout and hearing are reduced job satisfaction, insomnia, a lot of problems with sleep, withdrawal, isolation, and feelings of anxiety, irritability with patients or colleagues, exhaustion, just feeling that sense of dread before work. But the 3 components of burnout that you see depicted below, emotional exhaustion, depersonalization, and reduced personal accomplishment, these are the 3 main indicators that have been studied as signs of burnout. So it really is a sense of detachment from self and others, not really feeling like you care, that it matters what happens, or that you care anymore about the outcome of things. And sometimes it may even get to the point of not feeling like you want to be here anymore, even leading to some passive suicidal thoughts. And unfortunately, that is a common experience. So if you are experiencing any of those things, even if it's not actively wanting to harm yourself, please take those thoughts seriously and seek out that support. Talk about it with a mentor, colleague, friend, and if you're comfortable, reach out to a professional that can further help you. It really can make a difference to catch burnout. So you as a person, in order to thrive in your relationships, we need to recognize where we're at, right? And burnout really is one of the things that can affect us. So just simply, again, noticing changes in you, how you generally cope and deal with day-to-day stress? Is it starting to feel heavy or harder to get by, difficult to get out of bed, really struggling to make it through the day? Maybe how are you showing up in your relationships? Have you stopped doing the activities you love to do? And of course, changes in patterns of sleep, appetite, or energy. Really, if you're just sort of telling yourself, when this happens, then I'll feel better. When I get to the weekend, then I'll feel better. That's definitely a sign that you're starting to feel, if not already, depleted. So we really want to stress this self-awareness tool that I'm about to introduce as a self-monitoring tool. And the question I might ask you right now is, would you ever think of burnout as an injury? What about a physical injury? So in this model, we're going to be looking at stress on a continuum and stress injuries as physical injuries or a depletion injury. Ha ha ha, there's my curtain. This is the big reveal. So here's our responder stress continuum model. This is actually a model adapted by from the military when you think of being mission ready and sending folks out to deployment versus needing medical treatment and not feeling ready to serve. And it's been adapted by my colleague Laura McGladrey with the Responder Alliance. Her expertise lies in working with first responders. So basically what I want to share here is that this is a continuum. So we don't land in one and stay in it. It's a very fluid model. No one's ever 100% in the green. The goal here is to be able to know, what does it feel like for you when you start to get in that yellowish or orangish phase, so that we can catch these signs earlier. And we're going to talk a little bit more about that. But let's launch the poll question here. As we're looking at these symptoms, signs, themes in each area of the color, in your first glance, where are you trending today? How are you doing? Just checking in with yourself honestly. What's going on with you? A lot of these are self-explained, not hard to understand. So just kind of thinking, am I feeling open and ready to take on the day and rested? Or am I kind of feeling on edge and maybe lashing out from others, cutting corners, not really feeling my best self, just ready for the day to be over? Perhaps I've been having nightmares or actually feeling physical symptoms of pain and muscle aches and so forth. So once we have those results, I'd be curious to see how we're all doing today. All right, so we have about half of the people who reported in the poll in the yellow. That's not bad. I would say that's pretty common in the middle of a work week sometimes. But yeah, 28% of us feeling injured, and about 17% of us in the green and 1 in the red. So glad to see some of us are in the green, and hopefully by the end of today, you may feel a little more space or maybe a little more room to breathe with learning some tools. So again, what does it look like? What does it sound like? These are just some quotes that my colleagues and I have been hearing in our sessions and in our work with our healthcare workers this year. And this may be another way to think about where you're trending or landing. Thinking of physical symptoms, are you starting to develop headaches or stomach aches, right? Or are you feeling energized and focused? What are those things that kind of get you off track or make you feel overwhelmed or trapped? And even others, asking family, spouses, children, friends, what does it look like when I'm off, not myself, stressed? Maybe I walk away from conversations, or I start lashing out, or snapping at my partner or yelling at my kids, right? What are those signs that I'm starting to feel a little drained here? So we're, again, increasing our awareness of these individual signs, and we can intervene earlier with supportive strategies. We can reduce the likelihood of creating an impact. And I just want to remind us that these stress injuries that we're considering physical injuries are reversible and treatable when recognized. They're also very common and predictable. We just don't always think of it as an injury, right? It's easier to say, I haven't had as hard of a day as my colleague, and start to compare ourselves. But if we're in that system and we're feeling that burden, we're likely to be injured too. And that's what we're talking about, a psychological injury here. This is a model that we can also apply to our teams. And maybe just in this moment, quietly asking yourself, where do I feel like my team is at, my unit is at, my floor is at, and what contributes to where we're trending on the continuum? Something to think about is if a person is really feeling in the green, so to speak, or even what we like to say limoncello, we were always looking for that greenish yellow, and they show up to a system that has limited resources, low staff, a lot of culture of blame, right? All the things that you're seeing. How do you think that's going to deplete that person, right? It's going to be hard to keep room for green choice behaviors and create that capacity. So now that we're really understanding the importance of the self-monitoring tool, let's look at some specific strategies to build more capacity and trend toward green and hopefully mitigate burnout or prevent it. So here's a battery snapshot. This shows some charges and depletions that may contribute to our well-being. I love this because it's so simple, right? Batteries we need for our machines. If we think of our human machine as something that needs fuel to get through the day, the week, the year, to help people to carry out our lives, we can't expect it to keep giving and not get back, right? It's just like we can't take money out of the bank and expect it to just reappear on its own without doing the work. So I'm not saying that this is easy, but it does require a slowing down and a noticing of what's really important for us. It's self-awareness as a strength. And on the same note, if we notice what really drains us and creates an imbalance, we can start to, hey, I'm starting to feel a little orange, and these are the areas that are contributing to that for me today. Maybe I have a heavy patient caseload. Maybe I'm working with a difficult case. Maybe I didn't really sleep that well, or something's going on in my family, or I just learned that someone I love is sick. So all of these things can kind of contribute, right? And it's very, again, fluid. The next concept to consider here is also that some of the things that are good for us can also turn bad for us, right? When we get overwhelmed. And we consider these numbing tools or survival tools, right? When we're under threat, we're doing what we can to survive. Think of this as like diving in and scrolling aimlessly on your cell phone, or binge watching Netflix, or really taking on extra shifts and just diving yourself into work and ignoring those relationships. So this can really turn into a numbing type of behavior if they're excess or out of balance. And we all do this, right? So if we know how we numb, we'll know when we're doing it, so that we can again say, oh, here's an opportunity to step back and maybe make a different choice, or notice how this is actually helping or not. And typically the further in the red we are, the more numbing tools that we're using to get through our day. The Responder Alliance has great resources for you to access. We're going to post that in the chat as well. This is just one example of how they've responded to the COVID-19 crisis, and they've adapted the stress continuum model with COVID. And again, I just think we've gone through so many layers and phases of this, and it's so interesting to me, from kids being in and out of school and having to parent and work and really just lose all of the support and routines that we're used to having. It really can change it. And in some way, I feel like we all have gone through a collective trauma. We're grieving the things, that used to keep us in balance. So feel free to access that website for more podcasts, articles, tools. They have cards you can distribute to your teams as well. So now take a moment, maybe take out your note section on your phone or a piece of paper. And I'm just going to leave a minute or two to create some space for you to think about 2 to 3 charges, maybe for your week specifically, that you've been doing, and then maybe a couple of drains. Or depletions, or things that are contributing to the lower fuel. And typically these are general and specific. They're general in the sense that they're common patterns, right? We all have our patterns, but you really want to make them as specific as possible. So for example, for me, one of my charges might be having 20 minutes of quiet time in the morning with my coffee and my cats. versus a drain might be, missing the staff meetings in person and that social connection to people, passing them in the hallway, right? A lot of us are still working full-time from home for a year. Let's launch that third poll question for us, just to get us thinking a little more broadly and just to kind of connect across themes here. So what did you list as you're writing ideas of charges down that, or actually this is the depletion one. So we can think about what are depleting us, and you can check as many off as you'd like. And feel free to type in the chat if you want to share and connect with each other as well. It's just really pausing and slowing down and really thinking, what is it that typically makes me feel like I am not doing a good job, or that I can't keep up, or that I'm tired, right? And then what are the things that I can do to sort of bounce back or rejuvenate? There's so much guilt with taking time for ourselves, especially in high achieving environments and in healthcare, especially if you're working shifts, right? And how do you bounce back from sleep schedules being all over the place? So let's see what we have for the depletions. I'm glad that you're all participating. Yeah, this is a great scattered across the board list. General work stress, yes. COVID uncertainty and stress, yes. Lack of exercise, time for other things, absolutely. Boundaries. I mean, I just sigh hearing this. Yes, like, and so you're not alone, right? Look at these numbers. And let's go to the charges poll question if we have that one ready. And if not, that's totally okay. Oh, here we go. Okay. So let's list the things that energize or fill up our battery. You know, sometimes I like to think of this as, what is it that makes time stop for you? What is it where time doesn't really matter? You're not really attached to an outcome, helps you get in the present. What is it that makes your soul feel alive, right? Maybe something you haven't done since you were a kid. I just got myself a pair of roller skates, and it's so freeing and very difficult, but something that makes me feel childlike again, right? And whenever we feel like we can launch the results of this, we'll see what the audience has to say here. So typically, what are our charges? Being outside, yes, especially if we're in Colorado. I feel very grateful for the mountains during this year. Exercise is the top one, and connection, time with friends or family. Yeah, so we can imagine, why are we continuing to expect the same results when all of our productivity, our achievements, when all of the things that make us feel good have changed, right? So we have a patient care plan and we take care of others. The question I'm going to ask you is, what is your individualized resiliency plan? What is helping you grow through the cracks of COVID during this time? This is one model. Feel free to print it out and you think about it as your deployment model, right? When you go into battle, you have to be prepared, but it's just another way, a different lens to think about considering the battery as well. These are elements that help us feel like we have the ability to bounce back, that we feel connected, that we feel like what we do matters, and that we have a sense of purpose. So this may range from anything to having a skincare routine, to watching a garden grow, or doing a puzzle and seeing the progress of that. This may also just be having that regular FaceTime call scheduled. Maybe having a designated hugger at this point in time for that sense of connection. And then that sense of future, right? You know, pandemics have a beginning, a middle, and an end. So maybe, as the example says, as you're brushing your teeth, imagining, what is it going to be like again, right, afterwards? And just another tool that you can use to really access different ways of really stopping and thinking what does this green version of me look like, even if I haven't been this way in a while, or maybe have seen glimpses of it. Here are some actual examples of getting as concrete as we can. Right? What fills up our cup? What do we like to do? Outside of work, saying no when I feel overwhelmed. 50% of you said boundaries as a depletion. Absolutely, your lack of boundaries. So here are some key areas to think about of other ways to stay charged. A lot of these you've heard before, but the ones that I want to highlight, other than the boundaries, which we've been talking about, and that could look like even not filling up your calendar or making time to do nothing. Some sense of efficacy as well is maybe just writing down the top 3 things you'd like to accomplish today that will make you feel good, even if that's a load of laundry or calling someone or finishing your charting, and breaking it down into manageable tasks. Another thing, especially when we make time for self-care, is be flexible with yourself. Maybe you have a plan to go for a run, but for whatever reason, you're feeling depleted and you don't have the full hour that you thought you did. And so you need to kind of meet yourself where you're at and do a little bit of a walk or a little bit of yoga instead. And that's what you need. Maybe you need to cook yourself a nice meal with lots of colors in it. So allow yourself to cancel plans with others, with yourself. Allow that change to happen. Find something that actually genuinely relaxes you and take the time to do it. I know it's hard, but taking that 5 to 10 minutes a day really can make up a difference. And then with compassion, if we have more compassion for ourselves, it actually helps us have more for others. Brené Brown talks about this on a podcast that I recommend. And it's true, empathy is infinite, right? There's not finite amounts of this. Just because you're suffering and I'm not, doesn't mean I can't hold myself with just as much compassion and have patience, as I do for you. And managing those expectations. I think I saw an amazing quote a while back that just said, we're expecting from each other what none of us can give, right? So just being honest about what are we showing up as. The 50-50 myth is typically in partnerships that we all show up 50-50. And that's what you bring to the relationship, but that's not the reality. We know some days I'm going to be more stressed, or other days my partner's going to be, have more capacity for stress. So what do you do when you have that gap, and how do you practice kindness and empathy and make sure you're getting your sleep and meals and movement in with each other? Another thing you can think about, especially if you have the ability to control your schedule or work from home, and a lot of those commutes or other things have been taken away from you, have as much structure and routine as possible. Make the same bedtime and wake time. Have a morning ritual. Do something to ease into the day, especially if you don't have that commute, because we don't have that opportunity to sort of mentally switch and get into that work zone. And again, set working hours. I don't even mean 9 to 5 or 8 to 5 if you can't do that. Maybe I mean, how many hours do you really feel realistically you need for this? And then genuinely, trying to uphold that boundary if possible. Making a leisure hour, again, not feeling guilty about giving back to yourself for the reasons we've already discussed with your battery. And taking into consideration how a little bit of planfulness can go a long way. Sometimes making the effort to plan out your week on a Sunday can really take a lot of those decisions away from you and make you feel a little less overwhelmed. Taking breaks, being flexible with yourself. There are a lot of things you can do for focus and motivation. If you're a task avoidant, setting a timer for 10 minutes and trying to start it. Typically you'll work longer on it. Sleep is something we're, as a society, I think really struggling with, and so many of us have reported sleep problems this year. But we really need to prioritize our sleep, because it just becomes this vicious cycle of what happens when we don't get enough sleep, and how hard that's going to be to actually monitor this level of stress throughout the day, right? This is impacting our health. and further draining our battery. So if we can know what's going to push us out of that green and toward the yellow, just think about how sleep can also have that domino effect. It increases our immune system. Studies have even shown that it helps the vaccines be more effective if we have sleep. It can enhance our mood, right? Lack of sleep is also linked with different mental health conditions and PTSD. And we just feel clearer, right? When we get good sleep. How do we do that? These are just some basic tips. Ideally, you want at least 7 hours. Try to limit those naps, maybe to 10 to 20 minutes. Trying to get up at the same time every day. And really creating a comfortable atmosphere in your home, in your bedroom, and bringing things in that make you feel a sense of calm. Maybe establishing a sleep hygiene routine an hour before bed and doing the same things in the same order, right? Avoiding caffeine, alcohol, screen time, things like that. You may even want to do a worry log and just kind of write all the things that are on your mind before you start to wind down so that you can leave that there and give yourself permission to relax at night. And another way to think about this is through the battery, right? What are the things that contribute to good sleep versus negative quality sleep? So this probably isn't anything new. You've probably heard a lot of this, but when was the last time you actually took the opportunity to do any of it, right? And why are we not putting ourselves first in that respect? Trying to answer that honestly and lean into those fears a little bit. Sure, there's always something to take care of, always kids to take care of, notes to take care of, work to take care of. But again, we can't take that money out of the bank without putting it back in, right? So another tool that can help us notice these signs and symptoms and where we're landing on the continuum is mindfulness. And I want to spend a little bit of time defining it. So mindfulness is a paying attention on purpose with openness and attentiveness. Consciously paying attention in the present without judgment. So we're being very objective here, labeling what's going on around us objectively without attaching our judgments, opinions, or subjectivity to it. So what might this sound like, right? I mean, Craig mentioned the snowstorm coming. So maybe when it gets cold out, instead of saying, I'm freezing, I hate the cold, maybe notice the change of body temperature and how my body's responding by shivering or getting the chills to keep itself warm. I notice my teeth chattering or the cold air causing my cheek to tighten up and my skin to respond to that, right? I'm noticing it's very uncomfortable. I'm telling myself I don't like this. So it's just catching those thoughts, right? And being able to place them without that attachment. And I do think that mindfulness helps us to slow down, notice what's happening, and be able to respond instead of react. It can help our focus, memory, attention, even anxiety and depression. And we all want to feel calm, right? So yeah, we have a busy, chaotic life, but just keep calm, brush it off, carry on, right? Isn't that how it works? Not quite, right? Brené Brown defines calm as perspective, mindfulness, and the ability to manage emotional reactivity. People who are calm bring perspective to complicated situations and feel their feelings without reacting to heightened emotions like fear or anger or exhaustion in some of our cases. So in this podcast, Over Under Functioning Anxiety, she goes through 3 steps of practicing calm. And I think they're very helpful and really define mindfulness to create a perspective shift. Number 1, she says, try to be slow to respond and quick to think, do I have all the information I need to make a decision or form a response? Because a panic-driven decision is usually due to a lack of data. So by asking ourselves, do I have the information I need to respond? 2, stay mindful of the effects that calm can have on an anxious situation. We have mirror neurons that pick up so much information in a room. We all know times where we walk into a room, we're feeling fine again, and we feel the anxiety, and that could bring us up. But trying to meet that with a different level of cadence, tone, and level, and be mindful of our own internal processes in that way. And that can actually decrease the level of anxiety. Number 3, by asking ourselves 2 questions. Number one, do I have enough data to freak out about this situation that's making me upset, anxious, or fearful? And she says 90% of the time I don't, and I'm pretty sure that's true for most of us. And number two, will freaking out even help if I do have enough data? And the answer to that is always no. So here are some ways to slow down in our day. I try to think of very practical examples here for you. So maybe instead of running into the next room or jumping from, place to place, stop. Notice how your body's feeling. Notice if you're holding on to your breath. Ask yourself, where am I feeling tension? Instead of rushing out of the car as soon as you get home, maybe sit, ground yourself, take a few breaths. That 30 seconds can really make a difference. Instead of ignoring my physical pain, headaches, stomach aches, maybe notice the physical sensation, describing them, how the pain shifts, where it's going. Is it intensifying? Is it shooting? Is it circling, right? Labeling them the best as I can. Instead of rushing through my meals or chugging water, really maybe appreciating where my food comes from. Enjoy the taste and textures, the cool temperature of the water. Appreciate nourishment to your body. And this one's my favorite. Instead of complaining how tired and exhausted I am to myself or to someone else, label those physical feelings to yourself, right? If you have a hard time waking up in the morning, this is a nice one to really describe that. My legs feel heavy, right? My head feels pressured. I'm feeling a resistance here. A stuckness. So when we label, it tends to diffuse it a little bit, and instead of metastasize and pushing down those feelings, they tend to be able to mobilize a little bit better. And here are some practical tips and takeaways. I have a link to Square Breathing. It's an audio recording of about 6 minutes. If you're interested in that, you can direct message me or email me, and I'll provide my email in the chat. And we can get those to you. But I just want to take a moment and let's just take 1 minute. And if you're comfortable, if you're in a space to do so, or even if you're walking around, notice your breath. And if you feel comfortable, maybe gaze down or close your eyes if that feels right for you. And I want you to just place your hands on your belly, one or both, and ask yourself the question, am I physically safe in this moment? Is anything endangering my life? 99.9% of the time, the answer to that question is no. But our fight and flight and freeze response is usually hyper aroused all day with various stimuli. And so it doesn't ever know when to shut off. So if you're sitting down to breathe, remind yourself of your physical safety and well-being, and that a saber-toothed tiger isn't running at you, right? And letting down those walls that kind of prevent us from taking a deep breath, and just noticing the shift there. Taking a deep breath in through the nose, feeling that connection with your hand and belly, the gut and the mind that are so inextricably linked, and sending that message to our body that we can relax and feel safe. And while you're in this space, I'd invite you to take a few deep sighs with me. 3 mindful, deep breaths, breathing in through the nose, filling up the belly. And exhale the mouth. You can even visualize breathing in a sense of peace, rejuvenation of oxygen to the brain, and breathing out the stress and tension from your day. And this can be done anywhere, right? Taking one more on your own time. The sigh is our body's automatic way of reducing tension. We can voluntarily access it. Just by taking a few deep breaths, I feel a little more space, right? That's the goal here. Another grounding technique you can do is the 5-4-3-2-1 technique. Basically, what that is labeling 5 things that you see, 4 things that you touch or feel, 3 that you hear, 2 that you smell, and 1 that you taste. So Typically when I'm in a Zoom room, I'll ask for a volunteer and do this, but I just want to give you a few examples. What I love about this is not only does it get us out of our heads a little bit, but it kind of really forces us to look at the present moment and the reality and the clear lens in which we're seeing it. So almost pretending like you're describing it to someone, that maybe you landed on Mars and you're describing it to someone that doesn't know what this is, right? So I see my glass of water 3/4 of the way filled. It's cylinder shaped, it has pictures of the mountains on it, and it's filled with a clear kind of bubble liquid, right? And maybe I see the curvature of my desk and the white color that it has, and maybe I see the shadow of the light on my wall and the curvature of that. And so really zooming in and describing the color and the texture and the shape. If you're outside looking at the clouds and noticing the shapes of the skyline, for example. Sense of touch is my favorite because you can use durability, softness, hardness. You could use temperature. So I notice the cool air against my face, or I notice the hair resting on my neck, right? I notice the coolness of my breath as I breathe it in versus the warmth of it as I breathe out, right? I notice where my back is against my chair and the squishy nature and supportive nature of my chair. 3 things that you hear, that's pretty simple. Smelling, you can smell the stale air or maybe something citrusy or acidic if you had coffee. Taste is interesting because if you ask yourself, what am I tasting? Your body thinks you should be. And I start salivating usually when I do this one. But again, it could be, nothing, neutral, bland, but mindful eating is a great way to practice this, really appreciating the taste, describing them, right? Really practicing that slow appreciation. This is another link of an audio clip that I recorded. It's one of my favorite ones I've been using for so long, the 5-finger visualization exercise. And it really recounts positive memories. And again, just gives you a little bit of a glimpse into different experiences, reminding us of other ways of connecting. Another one of my favorites is the loving kindness meditation. This boosts forgiveness, reduces rumination, gives us a sense of peace. There are so many links online to this, but I think this one's great right now, especially when we're feeling so disconnected. But you really usually you repeat these phrases that are on the slide to someone toward whom you positively regard, someone whom you feel neutral toward, and someone that's giving you a hard time, that's kind of difficult in your life right now. And then you can expand that locally in your community and globally and universally. And it just produces this sense of compassion. And just general other tips to slow down. I'm not going to go through all of these. I think really just asking yourself what helps you slow down, right? Whether it's making an intentional transition or taking some time in the morning without looking at your phone. What are the things that you can do to really be intentional and mindful throughout your day? And what are you already doing that you can be mindful with? Maybe by washing the dishes, you appreciate the smell of the soap and where the water is coming from, right? You can make anything really mindful. So what is your prescription? We give prescriptions for so many things, but what about this? What about something that's going to give you access into slowing down and recognizing your depletions, preventing injury, preventing burnout? If you want to learn more, there are a multitude of apps. The ones that I usually recommend are either Insight Timer, if you like the quiet meditation practices. Headspace is actually free if you have an NPI number, which is really nice. That's the orange dot on the left. I also really love Dailyo. It allows you to kind of get on track with various wellness behaviors, and it charts them and scales them and stuff, so you can see your patterns. I really like that. So there's a multitude of resources to explore there. The last point that I want to talk about is seeking help, right? When we feel this overwhelm, this stress, a shorter fuse, it's probably a sign that we need more people in our corner, but it's often really hard for us to ask for help as helpers. So just wanted to remind us that it does create a sense of meaning, helps us follow through with ourselves. and then may even help us feel better for our patients and giving better care. Often what we want to do when we're overwhelmed is to isolate, but what we really need to do is the opposite. My little origami bird going to ask for help. So reach out, right? Think of the people you haven't talked to in a while. Make a plan. We're so zoomed out. Zoom fatigue is such a real thing. Hang in there, right? Be creative. We're at a phase where we may be able to start practicing some behaviors that make us feel safe again and having those conversations, but really just opening up about what you need, letting someone know what you are struggling with. It tends to create a sense of vulnerability, and chances are they're struggling with something too. Really letting them know what you need, or if they have the space to talk something out. And thinking of all the different people you can go to, right? Instead of just the same one or two, really think of this as a network of people around you. Even if it's not, everybody you wouldn't tell your deepest stuff to, still, maybe you can ask for help in other practical ways. And turning this into patient care, there's a lot of things we can do with this topic, right, of mental health and patient care. One of the best things we can do is screenings for anxiety and depression, using the full PHQ-9 and GAD-7 with anyone who reports it being a difficult time, offering that hope and support, creating a referral. And you may just want to ask everyone, are you struggling emotionally or with any major stress at this time? How are things going for your home and family? How have you guys been doing? People are often more likely to report physical symptoms and pain as opposed to psychological or emotional symptoms when presenting with depression or anxiety. And remembering these concepts while we care for others. Are our patients eating while sleeping, while moving, staying connected, getting adequate social support? So just normalizing it's okay to reach out for support. How do you do that, right? Opening up a conversation about mental health is hard sometimes. So just noticing what you see behaviorally. So for example, I've noticed you've been working a lot and juggling homeschool and parenting without a lot of support. It sounds like you're overwhelmed and anxious. May I provide you some resources to help you talk through this? And then manage the conversation as much as they're willing to accept support. You can also normalize and destigmatize, right? 1 in 5 Americans suffer from mental illness. The average delay of treatment is 10 years, and early intervention can really help in lessening the impact of depression and anxiety. Our brains are such an important, if not the most important organ to take care of, so we need to take care of it, right? And for yourself, coming back to this idea of burnout prevention, really just being kind toward yourself. But I'd be curious at this point to ask the audience, while we have 2 minutes left, what do you do to shed the weight of the day? What's been helpful to you? So you'll see in the bottom corner, if you go to www.menti.com, you're going to enter this code in, and you can list up to 3 responses. And I'm going to stop my share real quick so that I can share this presentation. So we're going to go to menti.com and enter in the numbers 42596735. And hopefully I did this word cloud correctly. And if so, I should start seeing answers after you type them in. But we're asking, what are some adaptive coping strategies that you do? How have you been charging your battery? And what have you enjoyed this past year? What are some of the pandemic perks, so to speak, this past year? All right, we're starting to see the answers come up. I'm going to put in mine too. Give you 1 more minute on this. drives, baking, pets, cleaning, stretching, crochet. A lot of us are cooking. So the more answers that we get, the bigger that they become with this word cloud. Reading, meditation. I see someone has a puppy. Parents, baths, yoga, cleaning, chocolate tea, having quiet time. Awesome. New skincare routine. Awesome. Thank you for sharing all of that. Really great stuff. We'll come back for the last part of the PowerPoint before we get to questions. So I just want to share, take the time to fill out this battery. I think that is the best resource you could do for you, your families, your patients, and your kids. And here are some takeaways, right? Where are you trending? What are those signs you're in the yellow or orange? Based on your battery, what's one thing you can stop doing, start doing, and keep doing that you're already doing? Taking time to breathe, taking time to get grounded with one of the exercises we talked about, and listing 3 people that you can go to when you need support, and maybe what those barriers are for you of why it may be hard to ask for that. And finally, name one thing that you do that makes you feel good about your work, and just do that. Showing up is often the best job we can do for ourselves and for others. If you want to learn more and dive deeper into these topics, we have an 8-session series called Past the Pandemic. It's similar goals that we talked about today, and the next series starts April 20th. You can register at Echo, Colorado. It's available to anyone. We haven't been turning away people outside of state. And these are the series topics. So really today I talked about mindfulness and touched on sleep, but as you can see, we go through a lot of other things like relationships and parenting and grief, uncertainty, biology of stress. So if you're interested, that's a great resource. And here are some other resources for you if you're a healthcare worker, educator in Colorado. We have a well-being support line as well as a physician-to-physician line. And if you do want some more support with some small groups, if you're in the hospital system, you can email us at covidsupportgroup@ucdenver.edu. And finally, if you're a current faculty or staff, you can also come to our clinic if you need some help. And there's a lot of information on the website, so I encourage you to check it out. We're here for you. All right, and at that, I'll open it up for questions.
All right, Mandy, thank you so much for that presentation. I think some great resources and self and personal reflection that we can all do to improve our mental health. So thank you so much. If people have questions, feel free to add those into the chat and I will read those and let Mandy respond. I know there was one from earlier in the presentation that I'll review. So Mandy, it's a question from Whitney. She would love to hear what you recommend for coping with the broken systems of medical care. So the system issues that we don't control seem to take so much out of our time and lead to burnout. We talk about the individual ways that we can provide self-care, but is anyone addressing the systems that cause or contribute to this burnout?
Yeah, that is such a great question. And trust me, that is a part of our everyday work on any task force. And our system at Anschutz specifically is so large. And so a lot of our work is working with hospital partners and really needing buy-in from the top down, because you're absolutely right. If there's not administrative buy-in to create a wellness day or give our colleagues the time they need or the support that they need, it's really hard to feel that system drain. I think the number one tip that I have for folks is to recognize what's in your control versus what's out of your control, and doing what you can and using that wise brain almost to know the difference of what you can and cannot do without internalizing that. But I think that it's such a crisis that we're facing, that so many people are wanting to leave healthcare because of the system drain, and we need to do better. I would also suggest seeking out a mentor and colleague support, even if you and write petitions. And I mean, that's why we have free speech, right? There's a way to protest some things, but I think we're working on it. I'm not sure what other systems I have in place, but I know that they've been building in more time for mental health appointments on our campus, for example. So that's a start. But you're right, asking us to do one more thing when we're already so busy is really difficult and not fair. And yeah.
All right. So we have another question. So thoughts on how we can continue to practice and incorporate these self-care and mindfulness techniques when we might be going back to a faster paced life after COVID?
Yeah.
Eating, traveling, running between meetings, less time at home, etc.
Love it. Yeah. So again, I think what I would say to that is practice makes, it's a practice. Practice doesn't make perfect with mindfulness because there's always going to be something that pulls us out of that. And welcome to being human, right? But on your commute, using the 5, 4, 3, 2, 1 exercise, not maybe all of them, but when it turns green, little things like that, feeling the fresh air, listening to music, anything that can kind of pull in the 5 senses on busy times. When you're fast paced, taking that 30-second walk to the bathroom and grounding through the soles of your feet, feeling your heel, toe, maybe even counting your breath as you're walking. I breathe in and I breathe out, right? Any way you can cue that sense of calm. And honestly, just monitoring that stress. Sometimes I'll encourage folks to label their stress from 0 to 10. And anytime you get above a 5, to do something to intervene, because typically when we're at a 7, 8 or above, it's harder to intervene. So trying to do things earlier on to mitigate that impact. But I think that's all of our fears, right? How are we going to transition? And my hope is that we've learned a lot about ourselves this time and about our strengths and about our resiliency, and that we do carry that and we become smarter and wiser for it. And that there is a lot of uncertainty still, and that's okay. Mm-hmm.
Or at our newly launched CU Anschutz Alumni LinkedIn group that focuses on professional development. Then stay tuned for information regarding our future happy and healthy hours, the next of which will take place on Wednesday, April 7th, 2021, during the National Public Health Week. And thank you again so much for tuning in and for all that you are doing as healthcare professionals for our campus and our community. We really appreciate it.
Thanks, everyone. Trend toward the green.